Hi everyone. One topic is very close to my heart. That is motepan, obesity. Do you really need surgery? So many people are very healthy. If I go to Western country, I see almost all are overweight. They don't need surgery all the time. They are hale and hearty. They are drinking, enjoying their life, looking fit. So those who are obese, who needs a surgery and who does not? Over and above that, if you see in recent literature, so many medicines have come which claims it can reduce weight, and that is partly true also. But I recently went through so many people, those who have taken those pills for weight loss. Though, that is called Manjura, that is very common now. So many companies that promotes that, and these GLP-1 agonist drugs, they really do a great job physiologically. But how to tolerate? Some people tolerates. Some people, you know what? They tolerate. They don't have any side effects. But what do they tell? We don't feel the desire to eat. खाने के लिए मन ही नहीं करता है, तो जीने के लिए मन ही नहीं करता है. So doing something like that looks little bit unphysiological to me. But even though for those who are having a leisure BMI, like between 25 to 35, they can still opt for these medications. They're like wonders. They control diabetes, they control fatty liver, and they do multiple good things. If you see anywhere, the majority is discussion of this role of these drugs in controlling obesity. Then what is the role of surgery? Still there is a place of surgery for controlling obesity? I believe yes. Like you see, someone is having very high BMI, like somebody is 120 kg, 130 kg, somebody is having associated diabetes, hypertension, joint pains, sleep apnea, multiple problems. In such scenario, with a very high BMI, I still feel the surgical treatment gives long-term cure. It's a single time treatment. Like you do a surgery and then you get rid of obesity. Majority of the time. You don't have to take medications, you don't have to take weekly injections, you don't have to go for long term, every week follow up with a doctor. Then, what is the problem with surgery? The fear of someone who is hale and hearty, reasonably okay, to undergo a surgery, whether the risk versus benefits, like whether I can tolerate the surgery, will it have some complications or not? Definitely, any major surgeries you do may have a complications, because these people, those who go for surgery, have multiple comorbid conditions like diabetes, hypertension, sleep apnea, breathing difficulties, so many problems. So they are high risk for surgery. So someone who is high risk for surgery, he is like, if I jump this, my life is fun. But if I jump, I might fall in the well. So वो जो jump करना है, कितना सही है, कितना गलत है, हम each आदमी हम पूछते हैं, हर काम में पूछते हैं हम, ये कर रहे हैं, अच्छा है, बुरा है. So like that. So every people thinks about that. So as a surgeon, in my perspective, if I can make that surgery so safe that patient in reality, not to convince a patient, in reality can overcome the surgery safely and get the benefit. That can't happen with open surgery. Forget about it. Very difficult. With a cut wound, they will not stay in the ventilator and all those. Coming to laparoscopy, until now, the surgeons have done a great job. But it has its own limitations. Like suturing, the vision, that has improved in laparoscopy. But coming to robotic, I'm talking, the precision is so good. I have done so many laparoscopic bariatric surgeries, but when I am doing robotic surgeries, I am more confident that I can do the job leak proof, bleeding proof, and the safety margins have increased due to the innovation like robotic instruments, which makes the step line almost leak proof. It makes the surgeons to able to put sutures much more efficiently. The vision is so good that we can go up to the all area of the stomach, and I am talking about a restrictive procedure like a sleeve gastrectomy.
मेरा ना बहुत वेट ज़्यादा गेन हो रहा था और उसके दौरान मेरा हर्निया हो रहा था, तो ज़्यादा दर्द हो रहा था. मैं बहुत सारे हॉस्पिटल में गया, ऑपरेशन भी 3 बार हुआ, मेरा सक्सेसफुल नहीं हुआ. वेट तो ऑपरेशन के बाद भी मेरा वेट गेन नहीं हो रहा था, वेट लॉस नहीं हो रहा था. मेरा ज़्यादा दर्द हो रहा था, तो मेरे एक दोस्त को नहीं मेरे जीजू को बताया, तो जीजू ने एक दोस्त के रिपोर्ट भेजा, तो उन्होंने बोला कि यहाँ पर आ जाओ, डॉक्टर विविदासी, वो रोबोटिक सर्जरी है, उनके साथ बात करेंगे. तो मैं रिपोर्ट भेजा, तो सर ने देखकर बताया कोई प्रॉब्लम नहीं, उसका सलूशन है मेरे पास, आप आइए. तो मैंने आया, सर को बताया क्या प्रॉब्लम है, तो उन्होंने बोला सर मेरा वेट ज़्यादा बढ़ रहा है. तो उन्होंने बोला कोई प्रॉब्लम नहीं, मैं सब ठीक कर दूँगी. तो उन्होंने बताया रोबोटिक सर्जरी के बारे में, एक साथ दोनों होगा. तो मैं बहुत खुश था. तो सर को बोला, फिर मेरे 22 तारीख को ऑपरेशन हुआ। मेरे सर्जरी में मेरा वेट 125 था। अभी सर्जरी के बाद 8 दिन पर मेरा 117 हुआ। मैं बहुत खुश हूँ।
पहले आपको सर्जरीज में जो पेन हुआ था, अभी आपको कुछ पेन
नहीं? अभी पहले जो मैं सर्जरी हुआ था बहुत ओपन सर्जरी हुआ था। मैं 3 महीने हॉस्पिटल में एडमिट था। इतना दिक्कत है पता नहीं। मैंने भगवान को मैं बोलता हूँ कभी किसी को भी ऐसे प्रॉब्लम नहीं है, लेकिन मुझ में जो दर्द हो रहे थे अभी ये रोबोटिक सर्जरी में मैं बहुत खुश हूँ। कुछ भी पेन नहीं, जो पेन है थोड़ा सा पेन है, मैं टॉयलेट गया।
और आपको अभी किसी और को जो भी ये प्रॉब्लम है, आप उनको भी रिकमेंड करना चाहेंगे?
हाँ, मेरे एक दोस्त को भी बताया, उन्होंने भी ऐसे वही रिलेशन में था। वो जो मैंने आप जाइए सर के पास, बीबी सर के पास जाके रोबोटिक सर्जरी की है। कहीं मेरा तो 3 बार हुआ था और पहले मुझे पता नहीं चलता था। अभी तो पता चला, मैं आकर के उनको भी बताया, उन्होंने भी आकर रोबोटिक सर्जरी करके गए। वो भी बहुत खुश है, मैं भी बहुत खुश हूँ। मैं गॉड को मैं बहुत बार थैंक यू करूँगा। सार भी गॉड जैसा है। फैमिली में भी बहुत टेंशन मेरे लिए, सब लोग परेशान थे, लेकिन ये भी सार का जो बाथरूम का ऑपरेशन हुआ सब लोग खुश है। मैंने जो कुछ हुआ तेरा जो वेट और नहीं गेन हो रहा है, नहीं होगा, जो ये सुनकर सब लोग खुश है। और एक बात मैं कहना चाहूँगी, मेडिकल के बारे में भी बहुत अच्छा लगा। सब सिस्टर्स भी अच्छे हैं, सब डॉक्टर्स भी अच्छे हैं, कोऑपरेटिव अच्छा है और साफ सफाई सब कुछ अच्छा लगा।
In which the surgery becomes much safer. Coming to other maladaptive procedure like a bypass, majority surgeons are now able to make suturing, joining intestines, bypass intestines much safer. Even a morbidly obese, very difficult case, because morbidly obese, this amount of fat in the abdomen will be there. So I strongly believe robotic surgery is extremely useful in building confidence in surgeon, in patient, and making the surgery much safer, thereby making more people, those who know that surgery will benefit them, to opt for it. So we should take advantage of robotic bariatric surgeries in indicated cases to make them much better in reducing their weight in a safer way and building their confidence in much better way. Thank you so much.